It seems that the government's way of dealing with this, so saying that it can be done through efficiency savings, £20 billion. Do you not think that's possible then?
I think it's more than just ambitious. I think it's going to be incredibly difficult to deliver. The low-hanging fruit was, in terms of efficiency savings, was delivered in the past 5 years in the 2010 to 2015 Parliament. Most of those efficiency savings were delivered through wage restraint, and that's obviously not going to be sustainable going forward. It's very difficult to have hard-working NHS staff having their wages in real terms reduced on a forward-going, on a long-term basis. So we then need to look at what other productivity savings are there. Clearly, some things can be delivered in some productivity savings through improved procurement practices in NHS trusts, buying, getting better value for money for goods and materials, better drugs deals from some of the drug companies. The quickest win on that, in my view, would be to better join up the way the different parts of the system talk to each other, to make sure that GP surgery records can talk more effectively to secondary care, to social care. The mental health system can talk more effectively with what happens in the hospital sector. It would improve the efficiency of care, but also could reduce costs. So I think having a more efficient technology. But all of these things, if you add them together, and even if they don't scale and pace, are not going to produce, in my view, £20 billion worth of savings. So we've got to find more money from somewhere, and that's going to have to come, in my view, from government funding. By 2020, we'll have almost had a decade of pay restraint, and that's unprecedented in any service, in the public or the private sector. So it's right, I think, to look at properly rewarding NHS staff. We're not talking necessarily about big pay increases. We're talking about pay increases that are, that recognise that prices in the shops have gone up over that 10-year period, and that people, particularly those who are at the top of their pay band, effectively will, over that decade, have seen a small reduction in their real take-home pay.
There's obviously a bit of a GP recruitment crisis. Jeremy Hunt said we need 5,000 more GPs by 2020. It seems from our calculations that the government's still a long way off. What would you say would be the best measure to actually try and achieve this?
I think we've got to look at how we properly incentivise more people to go into general practice, and also look at some of the regional variations in GP recruitment more effectively, because whilst some parts of the country are finding it easier to recruit, relatively easier to recruit into general practice, we know there are real problems in parts of the Midlands and the north of England. Health Education England have got some very good initiatives they put together, helping people perhaps with an extra year meet the necessary entrance criteria. I think there are some things that could be done more effectively, for example, better accrediting people with experience of other specialities to enter general practice or to contribute to general practice. That's something that historically hasn't been looked at in the way that perhaps it could be, and the Royal College may have more of a role to play in that. But what we do need, I think, really is genuine incentives and investment, particularly to deal with some of the regional issues. Queensland, for example, where they've got scarcity of GPs, they incentivise people to go and work in certain areas. I think we've got to look at that sort of thing as well.